Hi, I'm Dr. Anthea Rhodes, paediatrician at the Royal Children's Hospital in Melbourne, and here today for another episode of the Winter Wellness series in our Kids Health Info podcast. So it's autumn, winter's around the corner, and one of the things we start to see in our emergency department is croup. So here to answer some questions about that today and help you learn how to recognise the signs of croup and what to do if it's happening to your child is Dr. Tristan Harding, who is a paediatrician and a specialist in our emergency department. Welcome, Tristan.
Thank you, Anthea.
From the Royal Children's Hospital Melbourne, this is the Kids Health Info podcast.
So, Tristan, let's start with a really common question that parents have. What actually is croup?
So croup is inflammation of the airways, which is caused by a viral infection. What we tend to see is children are mildly unwell for a day or two with some viral symptoms, so runny nose, cough, sore throat, and then quite suddenly they can develop noisy breathing. The breathing is often when they're breathing in, and it's a sound we call stridor. And sometimes children will also develop a barking cough. It's very characteristic. It's sometimes described as dog or seal-like in nature.
And is there a test for it?
We don't test for croup. We can test for viruses, but we don't find it's helpful in croup because children's airways are threatened by their noisy breathing, and putting a stick or a swab in their nose or throat to test for it only causes more distress, so we don't worry about testing it. But we know it's only caused by a virus and it will get better by itself.
So to actually make a diagnosis as a doctor in the emergency department, it's based on what you're seeing and hearing, the signs and symptoms the child has.
Correct. The children will always have a runny nose or a cough in the lead up to the barking cough developing, and the noisy breathing is the other side of it.
And we know for parents it might be hard to actually know what that noisy breathing sounds like. So we've actually got a little recording of a real life patient from our emergency department that we're going to play now, so parents can have a quick listen to that.
That's the sound, and that is the classic stridor we see with croup.
And not all kids will get croup. Who is most likely to be affected by croup?
So croup is most likely to occur in children aged between 6 months and 6 years, and we don't tend to see much croup outside that age group. This is mostly because their airways in younger children are smaller and more susceptible to viral inflammation of their airways.
So if an older child or an adult or the mum and dad gets that same virus, how will it show up for them?
So usually in quite a different way. We might get the same symptoms of runny nose and fevers and a cough, but the cough's not the same as in croup. And often the sore throat and things that we tend to see in adults is the way we're characterising that, but we don't get that inflammation spreading to the airways.
Okay, so some good news is that ultimately kids will grow out of croup, is that right?
Correct, yeah.
Okay, so tell us a bit more about what parents should do if they think their child has this noisy breathing or particular barking sort of cough at home.
So we see croup on a spectrum. We see the more mild cases that might need to go and see their GP just for a checkup to make sure they're okay, to the more severe cases who do need to come to hospital. The things that would make me worried and would want my child to come to hospital would be if their breathing comes on quite suddenly as being noisy, fast or hard work. And similarly, if they feel like they can't catch a breath, they're really struggling. Children will adopt the most comfortable position for them, and sometimes they might be leaning forward or holding their head in a certain position. In that instance, you can either bring your child to the emergency department or call an ambulance, because the ambulance can treat on the spot with the two different options for medication, the steroid and sometimes, if it's really bad, an adrenaline in a nebulized form on the face.
Okay, so this might be one of those situations where if parents are worried, it really is a good idea to call an ambulance.
Correct, yeah. That being said though, most of the croup we tend to see is mild, and it can be managed in the community by a local GP or healthcare professional.
Great. So just to recap, if your child has no significant problems with their breathing, but just a bit of that barking cough, start with the GP.
Correct.
And if you're worried about their breathing and their general well-being, that would be more of a reason to perhaps visit the emergency department or even call an ambulance.
Correct.
So most croup is mild, you mentioned, Tristan. How can a parent look after their child at home with croup?
With croup, we want to look after a child the same way we would with any other viral infection. The things we tend to think of is pain relief if the children are complaining of a sore throat or they have high fevers, and similarly keeping their fluids up, because some children may not want to eat as much as normal when they're unwell, but as long as they're keeping their fluids up, that's the main thing. But it is safe for children with mild croup to stay at home.
So thinking about the family overall, is croup something that can be passed on from one child to another?
So whilst croup itself is not contagious, the virus that causes croup is. And we often find that when a child has come in and they're unwell with croup, other family members might be unwell with similar symptoms. So a runny nose, a cough, a sore throat, and maybe some fevers.
So staying home if you're unwell, hand washing, protecting your cough, all of those things apply to prevent the spread of croup.
Yeah, not just for the patient we're seeing, but for the whole family.
Thanks so much. Lots of helpful information there, Tristan. And croup can be frightening for parents to see and experience. So just to recap, croup is caused by a viral infection and it affects the airway, which is why sometimes it can narrow and create difficulty breathing and be quite serious in young children. Typically affects kids 6 months to 6 years of age, and the virus itself can be passed around the family and show up in older kids as a cough or a cold. If a child is having signs of difficulty breathing, so that noisy breathing in, stridor sound, that might be a sign that they need to get more urgent medical care, so visiting the emergency department or even calling an ambulance if they're worried. But most of the time, Croup's going to be mild and can be managed with supportive care
Correct.
at home. And of course, there's more information on our Kids Health Info fact sheet for parents at home as well. Thanks for joining us.
Thank you, Anthea.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.